The presentation I'm going to make is non-commercial in nature. We're not selling anything. Surface Solutions Group is a company that applies coatings, so we deal directly with PTFE and all the problems or potential problems that the industry is facing. So what I'm going to talk about is a collaborative effort between the United States EPA and the industry working together. What I'm going to present are the kind of a historical perspective as to how did this become a problem when PTFE has been used since the 1940s, and all of a sudden in the last 10 years it became akin to arsenic or some poison. You hear all these stories. And what the EPA is trying to do, and how these laws in America, the TSCA, this Toxic Substance Control Act, there's some real power that the EPA has and how it affects the industry. This is a very unusual thing in the last several years, where the EPA and organizations like the Society of Plastic Industries and 8 major producers of PTFE or fluoropolymers have collaborated and created a working group to make realistic laws that can be applied and used, and not something where we're simply told you can't use PTFE anymore. These are the chemicals specifically that are of great interest to the EPA, and I'll cover more of these in a bit. These are the action plans which are from the EPA, promulgated by the EPA, but industry has had a large component of effect and collaboration. There's environmental working groups. That means that it's a joint effort, not just the government saying you can't bring in or use certain materials anymore. And I'll finally wrap it up with what's the short term and the long term. If you look back at how did this happen, in May 2000, and prior to that, many of you may have used a product called Scotch Guard. It was made by 3M, and it was one of my favorites. You'd spray it on a tie, and you could put ketchup, nothing would stick to it. Well, that product was, from my understanding, by and large, consisted of PFOA, or perfluorooctanoic acid. And it is a chemical that's used to make liquid dispersions of water and PTFE particles flow together. And it's a molecule that's very difficult to disintegrate and has a half-life that's quite long. So 3M, on advice of their lawyers, stopped making Scotch Guard. What the driver was, they found that this chemical specifically was in the tissue of mammals, humans, and virtually in our entire globe, every mammal had some of this compound in their body. So 3 years later, there was a program on 2020. It was a television program hosted by Elizabeth Vargas. Now, she is a very well-skilled, I should say, interviewer. And the subject was the birth defects in West Virginia allegedly caused by DuPont, because they made a lot of the product they make called Teflon in that area. And the rationale was that there were birth defects, therefore there must be some linkage to the manufacture of PTFE by DuPont. Well, DuPont created a disaster, because instead of having someone who is a good communicator or maybe a little bit of a politician, they instead had as a spokesperson a doctor, a foreign-born doctor whose English wasn't perfect, and it made DuPont as a company look like they're hiding things. And it was memorable. We have seen that interview several times at the Society of Plastic Industries, because it tells us you really need to think about who's answering the question for your company. Really, it put us way back. And in a sense, it actually accelerated the issue today, so we actually have some resolutions. There's a famous American, Mark Twain, who was probably the poet of America, and he said something that really relates to this, because all we had here was a company that says we're not going to make this anymore, and then we had a program that said this stuff is causing birth defects. And Mark Twain said, you know, a rumor is halfway around the world before the truth gets its pants on. I guess they didn't communicate that right. In other words, the rumor just goes like crazy and nobody knows what the truth really is. These are a list of boring acronyms. All you scientists in the room will love this stuff, and I won't go into great detail. I see the smiles. So these are the issue chemicals that are of our concern, and these are the designations by the EPA of all kinds of procedures and policies and laws and regulations that they have in place. I'll cover a lot of these as we come along. What's the EPA trying to accomplish? When they say the EPA, the United States Environmental Protection Agency, is going to manage the manufacturer, they mean they're going to prevent certain products from being used in our society. And we'll get to that later. They're focusing on trying to get collaboration with a group of manufacturers who have already signed up to work together. But there is as many manufacturers worldwide who are not cooperating with the EPA. In other words, they're going to bring PTFE into America or try to sell it to America in a form that will contain PFOA or PFOS. What this word, the stewardship, is if there are certain areas where no other coating or product will function in a medical device, the EPA will listen. They'll actually allow you to present your case as the best alternative science available. So it's not an absolute mandatory no PFOA, but there are certain cases, most cases they won't allow it, but certain cases they'll listen. What our government is trying to do, the EPA, is trying to make a global resolution. They're trying to get all the countries who produce PTFE to join them in a stewardship to prevent the use totally, but that has not been successful to date, and I'll cover that in a minute. And there's ongoing research into other alternative materials. The PFOA, it's already been replaced by the major manufacturers. They have done a massive research to find chemicals that will allow the formation of the fluoropolymer molecule without the use of these PFOA or PFOS. Now, what is absolutely for sure is that the fluoropolymer compounds are found worldwide in everything. There's no question about that. All these quotes are from the EPA. Everything here is from the EPA. What this means is bioaccumulative. It's everywhere. Now, when we get down to persistent in the environment, we agree. But here's where the issues start to get really touchy. Significant adverse effects have been identified in laboratory animals and wildlife. Well, what's significant? I mean, it is, if they feed a massive dosage of your favorite breakfast food to something, we don't know what the negative effects would be. And this does not mean the word carcinogen is not up here. There have been potentials and some lab reports that say that they have had some carcinogenic reaction, but they're massive, massive quantities of these chemicals. So this is not an EPA mandate. The word cancer is not up here. I underline the not. This means the birth defects that were attributed by the television program were proven not to be. There were court cases, lawsuits. None of it was true. So the EPA uses that to help us now. And one of the smaller the mammal, or child in this case, apparently there's more accumulation in the tissue. So one of the major drivers is to keep all the chemicals, the PFOA, out of the fluoropolymer materials. This is from the EPA. It's exactly what they say. While we don't know what the adverse effect level would be in people, we believe it's important to limit future releases of these chemicals. Now, these chemicals were released in the manufacture of PTFE materials, could be solids, could be coatings like frying pans, medical devices, which means at the source of production, the manufacturing source. It doesn't mean where it was used. So there's, this is a big kind of an umbrella that the EPA wants to put out there, and they're being very conservative. What the ironic part for the medical industry is, almost every device used in the medical is room temperature, body temperature. Very rarely is something elevated unless it's electrosurgical blade, which is one of the things that DuPont or Whitford will not sell a coating for because they know it'll decompose at high temperatures, meaning over 550, 600 Fahrenheit. So there's an irony here that the medical device industry is actually safer for the use of PFOA if it's in a coating or in a product than a frying pan. It's truly, PTFE is the most inert polymer known to man. There's nothing that really will affect it. Very rare trace chemicals. But initially, back in the 2000, 2003, 4, 5, the news media actually, they seemed to win out, but the tables have turned. So the EPA works with the Society of Plastic Industries, and they have member companies. These companies are from America, and Europe, and Japan, that have agreed to manufacture PTFE coatings, PTFE resins without PFOA. And that doesn't mean they're free of PFOA, that means they're made without. They don't add this surfactant or soap anymore to their manufacturing process. But here's what's of concern to a lot of medical device manufacturers. If you're buying a PTFE product, and by 2015 there'll be an absolute mandate, you're going to have to prove traceability, where that product was made and where the resin came from, the PTFE resin. To date, the foreign manufacturers in India, China, and Russia have not agreed to become stewards, have not agreed. Now, there's a global initiative now where the EPA is reaching out to those big manufacturers, and I think we're going to see some headway in the next year. But this year, there's going to be some decisions to be made. This is how it has moved along, and right now we're 2012. 2015 is when the EPA is setting as a deadline that no PTFE product or coating brought into America, used in America, manufactured in America, can be made with PFOA. Can be made with. So there's several other programs that are moving along, but the primary one is if you deal or purchase product, tubing, coating, any number of things with PTFE, the manufacturer who makes the original resin has to be known by your supplier, and you need to work with your supplier to get them to provide you with the documentation. What we thought was going to happen, there would be some problems getting the EPA to allow enough time, and the industry, the large manufacturers, who I earlier pointed out, they have actually researched and found other ways to eliminate the need for the PFOA. So we thought there might be some transition problems, shortages, and price increases. Not the case. So frankly, the EPA allowed the industry till 2015. By 2011, all those 8 manufacturers already have materials that are made without PFOA. However, keep in mind, if you're getting some material from some other country that's not in a stewardship program, you may have a problem. What they're trying to do is, the EPA is getting all the countries to comply. And this is global. There's still an exclusion, and I'll touch on that later, where if you absolutely have to have some fluoropolymer material that has PFOA and you cannot find a substitute, there are exclusionary rules that will consider these critical applications. And later on in the presentation, I'll give you the names and the emails of the EPA administrators who have really been very collaborative and helpful. And all we want to do is just avoid more problems. Now, specifically with coatings, what Surface Solution Group applies, to date, now in 2011, there are coatings for the medical device industry, pure PTFE coatings that are used already that have no PFOA. Now, the wording by the manufacturers is, this is DuPont coatings and Whitford coatings, and there are others too, is that they're manufactured without PFOA. That does not mean they're ever going to say contains no PFOA. That can't be guaranteed, and I'll touch on that a little bit later. So, wait, let me, hold on. Sorry, I missed one here. These coatings are these are the oldest Teflon coatings, PTFE coatings known to the industry. These are made from water or aqueous dispersion. These are the ones that needed the PFOA to get things, actually as a surfactant, to get that to work. So these have already been developed, and the major manufacturers of coatings, DuPont, Whitford particularly, have coatings in stock now that are guaranteed not made without PTFE, I'm sorry, with PFOA. If some company says to you that they have a product, PTFE product, that does not contain PFOA, be very careful, because it's virtually impossible to prove that, but it is possible to analyze the materials, because now you can research trace elements to 1 part per billion. So this is not a guarantee one of the 8 companies will give you. Now, there are other coatings that are available and have been available for many years that are made with granular PTFE and granular fluoropolymers. These have never been ever manufactured. The parent resin has never been manufactured with PFOA. They're fine particles that are ground up and they're put into a matrix resin, a bonding resin like polyimidamide or polyarenal sulfone. And these are very well used in the medical industry now, but they are a little less, they're not quite as slippery, they're not as inert, and they're not as well accepted for most devices. And this is the distinction between the aqueous on the first slide and this one. These other coatings that are fluoropolymer based are quite well accepted, and they are not 100% PTFE, but they do have no PFOA and never did. Now, there's many other coatings that many other coatings that are being researched and driven by the cookware industry, which uses 1,000,000 times more fluoropolymers as a coating than does the medical industry. So this is by and large the primary manufacturers of top-line cookware, whether it's made in America or overseas. It's coming into America now, and it'll be stating, there might be a little EPA symbol that's being negotiated now where it's certified made with no PFOA. But this is going to help the medical industry because the volume of the cookware industry is massive. So the research is actually helping us, and we're like a little stepson or stepchild. But keep in mind, well, I'm going to touch on this in a minute, the Section 6 of the EPA, they have the power to ban the importation. So if you make a device and you can't prove the traceability of where that PTFE came from, and it complies with the no PFOA manufactured without PFOA, it's going to be embargoed. And keep in mind, the 8 companies who are now in the stewardship program, they are lobbying heavily to make sure that law is enforced. So it's really a dual-edged sword. You know, it is the global standard that the EPA is trying to enforce, and this is one of the mechanisms they're going to use, is actually embargo shipments. Keep in mind that it's not hard anymore for good analytical chemistry and some of the devices to really find one particle in a billion. So it's not going to take weeks or months. It'll take days and hours for some EPA regulator to know if something's out of specification, or I should say not in compliance. This is kind of boring stuff. If you're a lawyer, you probably love this, but this is all from the EPA. And it goes through all the assessment and the risks, and all this means that they're looking at this from a huge perspective as to what it's going to cost and what's the net effect, what's the benefit to society. I'm going to supply you with all the EPA websites after a while. These are more the rulemaking powers the EPA now has. And here's what it comes down, it boils down to this. These are the factors the EPA must absolutely prove before they can get Congress or regulations that make these major changes. And here is a summary. They must satisfy, the EPA must satisfy all 6. So once they do that, then the only option you have is to fight them in court or get an agreement with them because of this limited use of your product. There have been some exceptions to the mandates of the EPA when companies said there's an unreasonableness language is necessary, and there's all kinds of the burdensome, which means financially burdensome, the negative potential to society versus the benefit. And if you're going to change something, and they want to know ahead of time what alternates you're proposing. The implications get very, very complicated, and that's why I say it's the easiest path for every device manufacturer in this room, in this whole trade show, is to really work with primary quality, well-known manufacturers of materials and resins, because they will have done all this work for you. Again, this is the EPA, and this is the website. I'm not going to bore going through the whole thing with you, but it goes into greater and greater detail as to what their objectives and what their path is, to how they're going to accomplish things. But this is what's important, because it'd be a shame to have several 100,000 devices or even 50 devices manufactured that you can't sell. And that's the negative result of all these new regulations. We're going to be at 2012 next year, of course, and this is the Toxin Substance Control Act. They're trying to measure the unreasonable risk and all the costs, but we're already beyond this. The industry has agreed to already foot the bill. This stewardship program, what the goal is to try to expand that so that more than the 8 manufacturers are involved in the agreement. And it's been extremely collaborative to date, and I think and by the way, it's really 3 years ahead of when the EPA and the industry said we'll take out 95% of the PFOA, then we'll get out the last 5. They'll be at that point this year. Next year, you're going to start seeing it's going to be several years before the deadline. Here's where they're putting more effort to work with other countries. These are producer countries. That can be Europe, Asia, Russia. India, where they cannot to date get cooperation. And that's why they're talking about embargoes and all these other restrictive laws, because they can't seem to get the cooperation that they immediately got from the 8 primary manufacturers, who are also global. All right. Nothing should change if you're working with suppliers that have qualified resins. Nothing. The coatings that are now available are documented and are, according to the EPA, acceptable from now and all the way out past 2015. So the industry's way ahead of it already. This is the record keeping and things, the testing. This is what your supplier should be already doing or have done. Again, if there's some area where you've got something that has to have that special coating that's got PFOA, in critical applications, there's no good alternatives. The EPA will actually work with you. This is your primary source of the assets to help you. Your material supplier, whether it's a resin or a coating or tubing or a coated product, really has to be on the front line with the EPA if they want to really truly want to be able to sell their products. The EPA will actually help you, and they've been very cooperative. I mean, it sounds like not what we remember, like the old statement, "I'm here from the government, I'm here to help you." Well, none of us believe that, you know, but now it's really becoming a real collaborative effort, particularly in this issue. If you have any concerns that are legal in nature, and you have issues and you have a product that you're worried about, it might be embargoed or it might be prevented from sale, one of your best options is to get really qualified legal help. And there's a law firm, and I'll give you the name later, that works with the EPA in Washington, Keller and Heckman, who are part of the Society of Plastic Industries, kind of the database of people who are real familiar with these issues. Far more than I am, by the way. But this is one law firm. There are many others. And the Society of Plastic Industries is also a great resource. And if you're not members of the Society of Plastic Industries and your company can really join, and you can get instant access to what's happening and who's qualified. You can get name, rank, serial number of the companies and the specifics, the resins that are approved, because it's kind of a clearinghouse for information. The EPA is not doing that. They're doing it a little differently. They're putting much more burden on industry, but that's become a blessing because the industry now has a chance to really get their arms around this and make it so it's a workable situation. I'd like to thank Peter De La Cruz, who EPA put on a real nice seminar a couple months ago regarding PFOA and what's happening. And if you leave your business card or give me an email at the back, I will send you all these, what I'm going to show you in a minute, all the contacts. And these people, of course, are private law firms, but this is what we all pay for as American citizens and as you know, taxpayers. This man, Tony Krasnick, is absolutely in the center of the entire collaborative effort. He's in all the working groups, and he knows. He's probably going to hate me that I put his phone number out here, but this is really valuable, and he's accessible through email quite easily. He can help you either find out if the company you're buying from is even thinking or has resisted or has shown some interest in trying to work with the EPA. Now, right here at the MDM show, booth 3941, Mark Garrison from Society of Plastic Industries, and they can bring you up to date onto the working groups and the organizations, and there's various committees that your suppliers may or already be involved in it, because as I say before, it is really an opportunity to get it right without having all the lawsuits and all the screaming and haggling and never get anywhere. This is unlike our Congress. This is actually starting to work. And so the SPI works directly with the EPA daily. So they're working collaboratively. So these two groups are working together for the benefit of the whole industry, the medical industry. I told you I'm going to give you information. This is good bedtime reading. This will drive you nuts. These are all kinds of things that you can really thoroughly get confused about. And that's why joining, either get your supplier to help you get through this maze of regulations. Look at this. They have CD-ROMs. I mean, it's just massive amounts of data, which is all the more reason why if you join the SPI or you contact the EPA or you get a law firm to help you, they'll help you sort through what's really relevant and necessary for you to be compliant with. Anyway, it's the end of my presentation. I'd like to thank all the device manufacturers who really have tried to stay on the front line of what's necessary in America. You know, the medical device industry, as we all know, is remarkable. It's been robust. It's been helping people and humans have a better life through all the little devices that all you guys and gals dream up, and are either coated or manufactured with fluoropolymers. But this is a small blip in the road because it's under control, but do not take any chances as time moves on towards 2015, because if the regulations as they're written are going to be enforced, which I believe they will be, there will be a lot of sorry folks who have got devices made that aren't in compliance with these new regulations. And if you'd like to leave me a business card, I can send you all the EPA links and everything. Thank you very much for your time. Any questions? I'd be glad to try what I can do to help you. All done. We learned something. Thank you very much. Thank you very much. Oh, we have a question.
We need to throw away all the frying pan with Teflon.
No, come on. Go to the microphone and ask them. I'll handle that right away.
Do we need to throw away all the frying pans and rice cooker with the Teflon coating on it?
Well, now, you want me to answer that technically or commercially?
Psychologically.
Psychologically. Imagine Teflon, as I said earlier, or let's just say Teflon. What I really mean is PTFE. It is the most inert chemical, probably a plastic that we'll ever see. So, no, but your body's not 500 degrees. No, if you decompose the fluoropolymer, it will not be shiny and slippery anymore. But if you scrape it, that'll go right through your body. As a matter of fact, you're almost like my friend. You see this? Well, it's so slippery as Teflon tubing. This is a piece of Teflon tubing. Of course, the goal that our company had was to bond colors. But this is pure Teflon. It actually made with resin from DuPont. Now, it could be from Solvay, Alexis, Daikin, could be. But this is so inert, it'll pass through your body. There's nothing that's going to combine in your body with this. But if you did have a frying pan and you scratched it and scraped it and you had a bunch of black powder that came up, from my understanding, I'm not a scientist now, from my understanding, it's so inert, it'll pass through your body, because this is made to go in the human body for residence time. So I don't believe there's a problem. The problem is if you overheat the Teflon. If it gets over 550, 600 Fahrenheit, don't use it. Buy a new one, help us out. Huh? Any other questions? Have a good show, folks.